Vegas, people play cards here, right? And you're probably all aware of the way cards work. If you've never played cards before, that we have picture cards and number cards. No, we have red ones and black ones. We have, red ones are the diamonds and the hearts, and the black ones are the clubs and the spades, right? So I'm just going to call out something. I'll call something out and I'll ask you a question, and I just want you to answer what I ask. So I want you to pick for me, you just choose picture cards or number cards. Call it out. Picture cards, okay. From picture cards, I want you to do the aces and kings or jacks and queens. Aces and kings. From aces and kings, I want to do aces or kings. Kings. From kings, I want red ones or black ones. Red. From the red ones, I want diamonds or hearts. Which leaves hearts. So that was king of hearts. Is that correct? So there we are. So the question is, how was that done? Let's do it again.
To learn the secret to this and other magic tricks on this series, please go to EndoRootCamp.com. Hi, I'm Dr. Kit Weathers, and welcome to another Root Tip of the Week. I have a very special guest with me today, Dr. Michael Cernick. Glad to have you here. And Michael is going to talk to you. You've just seen an example of him doing a magic trick, and he used something that we call magician's choice, and I'll explain that when you go to the website and learn about the trick. But Michael uses psychology, and it's more like clinician's choice. And it's not a series of scripts, and in fact, it's impossible for me to tell you what he does, but in a few minutes we're going to have him describe as quickly as possible what he does and give you just a little taste of what happens when we go into prime speak. So let me just turn it over to Michael right now.
Well, in a sense, Kit, what we don't do is teach a bunch of scripts, as you've already mentioned, and we don't really teach sales techniques. Most patients who are in business have been to sales training, and we find that it's somewhat distasteful for the patient to be at their healthcare professional and have a sense that the dentist is trying to talk them into something. So we need ways of being able to have patients to want to have treatment, but not feel like they're being talked into treatment by the dentist. The reality is most patients that we see have chronic dental conditions, and by definition chronic meaning that doesn't hurt them, they're not uncomfortable particularly, and also it's been there for a long time. So when you've got a patient with that sort of scenario, to try to talk them into particularly expensive treatment is an uphill battle. We find that the dentist often is talking about the solutions, and the patient really hasn't perceived that they have a significant problem yet. So the way we look at things is we're wanting the patient to really understand what I call the deleterious consequences of their condition. If we can make that graphic and clear and accurate in the patient's mind, once they perceive that they have a problem and perceive particularly where this problem is going to lead to, they then will be motivated to take action to prevent from getting there.
All right, could you give us an example of what you mean by that?
There's a number of things we do. Part of it happens, in fact a big part of it happens in the what we call the preclinical discussion. In other words, the discussion that the dentist or a team member has with the patient before we even look in the mouth. We want to find out a lot of things about the patient so that we can get a sense of what is our strategic agenda as early as possible. When you think about it, if we knew that this patient is going to need to have a particular type of treatment, and we also know from speaking with the patient that they don't have a real sense of danger of their current condition, we need to create that now. We need to have our strategic agenda in our minds, but we also need to demolish the obstacles that the patient will naturally have to our strategic agenda. And the earlier we do that, the better. Typically what happens is that the dentist doesn't do anything like this. They speak briefly with the patient, maybe develop some nice bonds, and that's all fine. They look in the mouth, And then when they tip the patient up, they come up with a diagnosis and start trying to explain to the patient why that patient needs to have certain treatment. Most of the discussion centres on the type of treatment that the dentist is suggesting, and in the patient's mind they're still thinking, but I'm not sure that I really need this, and the patient will signal that by asking questions like, do I really need it, or what happens if I don't do it, or no, my other dentist didn't tell me this, or this sounds very expensive. So we end up with these objections. In my experience, most dental communications courses teach dentists how to handle the objections. I guess what I'm saying is what we do is focus on how to prevent the objections, and that's the key. And because it's many pieces of a puzzle here, it's a little bit hard for me to try to put it all together, but in principle what we're going to do is have in the patient's mind a real understanding of where they're heading before they even know that it's about them. And then as we do the exam, the patient starts to realise that, this problem applies to them. And by the time we tip the patient up and speak with them, we end up with a patient who's actually asking us for what are the possible solutions to a problem that they now clearly perceive.
Well, I know it's almost impossible to explain in 5 minutes what PrimeSpeak is all about. I've attended the course. It's a wonderful seminar. And one of the things that I really enjoyed was all of the analogies that you used to help make your points. Could you give us an example of one or two of those?
I understand what you're saying. I'll start by saying that typically what dentists do, in my experience, is to explain in clinical terms what the patient's situation is. And it's very informational, and often the patient doesn't quite understand it. So wherever possible, we like to sort of communicate with the patient at an emotional level. What I mean by that is to give them more graphic, easy to understand concepts. So if I were trying to explain to a patient, for instance, the fact that it's not uncommon if we were to see, let's say, a 50-year-old person.
50 years old, so somebody like me.
Or 40 years old.
There you go.
And that they've been wearing their teeth down. This is a chronic situation. The patient isn't aware of any particular problem. What they don't understand is that they have, once they've worn through the enamel and they're into the dentine, that the dentine obviously is softer, and there's a tipping point that's happened, and now the wear can accelerate. And we've all had patients that in a year they've lost millimetres of tooth structure because they've been grinding their teeth. And up to that point they weren't aware that there was any big problem, because really the damage hadn't been done significantly because it was just on the enamel. So to try to explain that, I might use, let's say, well, a pumpkin. I might say to a patient, you know, teeth are a bit like pumpkins. A pumpkin has a hard shell on the outside, then it's got the flesh, and then it has a cavity in the centre with the seeds. Well, teeth are a bit like that. And if we were to wear the pumpkin down, it would take a while to wear it through the skin, but if we got through that, the flesh would wear very quickly. That's what happens with teeth. So the wear and tear happens. It might take 40 years for a person to lose 2 millimetres of enamel, but then it might take a few months for a person to lose a couple of millimetres of dentine if the right forces are there. And then once that's through, they could be closer to the centre of the pumpkin or the nerve in a tooth, the pulp chamber, of course, but we can explain it in terms of that type of metaphor, that the patient gets an understanding of that the danger is that once they're through the skin of the pumpkin and they're into the flesh, they can be getting closer and closer to the centre where all the life is inside the tooth.
Well, what about an example for the infection that the patient might have inside their tooth?
Might use an analogy like fruit. If there's a little, it's often we'll see a defect in an apple. We cut the apple open and there's a little pinhole, but then inside there's a tunnel and then there's worms in the centre. Teeth can be like that as well.
Well, that's right. Nobody wants worms or those type of things in their teeth, so I think the apple is a great analogy. Listen, Michael, it's been a great pleasure having you here with me again today, and I hope that you'll be able to come back and visit with me very soon. It's been an extreme pleasure. Well, that's it for another edition of the Root Tip of the Week. I'm Dr. Kit Weathers, and I will see you at the Apex.